presentation?
Yes.
Thank you. I always like to double check before I dive in. I am the account executive for Blue Cross Blue Shield of South Carolina that's dedicated to the state health plan. As you all are aware, we manage the benefits on PEBA's behalf. This specific talk will be related to medical, behavioral health, and dental as it relates to wellness and the benefits and programs that are available to you through your benefits at USC. So we'll dive right in, and then if you have questions, please don't hesitate. Let me know. Let's see if I can get my slides to advance. There we go. So I'm going to start with some resources that are available to you, and then we'll go into more detail as we dive in. One of the first things I want to talk to you about is BlueCareOnDemand. So for those of you who are not aware, BlueCareOnDemand is an online service. It's a telehealth service. There's an app that you can download. You log in with your ID card, and the benefits are available through the state health plan. They are along the lines of urgent care, so it's available to you for things like pink eye and sinus infections, and even things like lactation consulting are available through telehealth services. But one of the things that we're particularly proud of are the behavioral health services that are also now available through BlueCareOnDemand. And it's great for people who are busy at work. You can take these calls in your office or from your car. We've had people tell us that they've gone out to the parking lot and had a session with their counselor, and it just really helped them. The access was simple throughout the day. So this is a program that we'll get into a little more detail on in a little bit. Health coaching is something that's also available to you for both chronic conditions and behavioral health coaching. We also have health coaching available for maternity. So for those people who are pregnant and expecting, we have health coaches available there. Quit for Life is a program that's available to you to quit tobacco and e-cigarettes. So if you or someone you know smokes or vapes, this is available to you. And this is also available for 13 and up for vaping, because that's been a problem in our country for a while now. And so people really wanted to ensure that those benefits were available to anyone who needed them. So Quit for Life is available now for 13 and up for vaping. Patient-centered medical homes are also a service to you. These are physician practices that have more of a team-based approach to your care. And the way that your benefit works, typically for a doctor's visit, you have a $14 copay, and then the plan pays 80% of your visit, and you're responsible for 20%. If you choose to see a physician or a practitioner at a patient-centered medical home, that copay is waived, and the plan pays 90% of your visit instead of 80%. So it's a great benefit to you. They take really good care of their patients. It's just a great aspect of healthcare that's available to you through your benefits. Rally is a digital platform that's available to you through your benefits. Now, this is a wellness platform. If you will log into your My Health Toolkit account, you can create a Rally account. You walk through a health risk assessment, and it offers you personalized recommendations based on the results of your survey. So if you say that your diet is great, but you don't have enough exercise in your day, it'll help you with suggestions and thoughts, and you can track your Fitbit or your iPhone or your Garmin device to that to help you increase your physical activity. If you say your physical activity is fine and your diet's great, but you really need some help with sleep, it'll give you ideas and suggestions and things of that sort. So it's a really great resource that's available to you through your benefits. And then Wondr Health, we'll get into in a little more detail here shortly. For those of you who are familiar with Naturally Slim, that was a program that became available to state health plan members in 2019. They have changed their name to Wondr Health to just better reflects their programs and services going forward. This is a weight loss program, but it's really a lifestyle skills program. It's 10 weeks. It's clinically proven. It's online, and you actually have a class that's coming up pretty soon. So we'll dive into some of those in detail coming up, but I wanted to give you just a general overview of some of the things we're going to be talking about. So mental health, I talked a little bit about that with BlueCareOnDemand when we first started. So behavioral health is a big piece of the benefits that are available to you. Virtual visits are available through BlueCareOnDemand. So this is that telehealth option that I was telling you about. You can video chat with a counselor. There are therapists, there are psychologists and psychiatrists, all available through this BlueCareOnDemand platform. They're available to talk about stress and anxiety. You can talk about family relationship counseling, that's available, depression, work pressures, grief counseling, trauma resolution. All of those things are available through this app. One of the benefits of this is it's available 24 hours a day, 7 days a week. So if you or someone in your family struggles more in the evening or on the weekends and you have a hard time getting access to someone, or if you're not able to take off work and go to those sessions during the day, like I said earlier, it's easier to take your lunch break, schedule this. You can take the session in your car, in your office. And we actually, you'll see here at the bottom on who's eligible here, we promote this because if your child is 18 or up, they can create their own profile. If they're under 18, you can register them on your profile, but it's available to kids too. And we tell people a lot of times for kids going to college, I guess young adults going to college, when you register them for college, register them for BlueCareOnDemand, because we all know that a lot of college-age kids struggle when they head off from home for the first time, when there's lots of pressures for grades and that sort of thing. And we found that this has been a huge benefit to college-age children, just to have this available to them in their dorm or again in their car or whenever they need it. Same with younger children in your home. This has been a huge benefit for our members. Health coaching for behavioral health. People think about our health coaching services more for diabetes and weight loss and things of that sort, but we have a whole crew of health coaches available for behavioral health disorders, or substance use disorder, ADHD, bipolar, depression, postpartum depression, anxiety. There's a team that's available to you anytime you need them. And if you don't want to talk to them, they can help you get connected with a different provider or find a provider for you in your area. So to connect with them, I have the number here. All you'd have to do is call this number and select option 2, and they would connect you or your family member with a health coach or help you get settled with someone who can help. We also now have peer recovery support. So for individuals who are struggling with substance use disorder, this is an amazing benefit. So for the first 12 months of a member's journey, as they transition to sobriety, they can be paired with a recovery support specialist. These people are nationally certified. The company that has the specialist is called MAP. And these are people with lived experience. So they've been there, they've gone through that journey, and they can help you or your family member come through this and go through those first 12 months that are such a struggle for people. They're there for the family and they're there for the member who's having the needs. And they can help with anything from housing, transportation, employment, life skills, because for someone going through recovery, there's a lot of things that have to be relearned to go back into the lifestyle that they wanted before, but not slip back into the old ways. So this is an amazing program that's available through your benefits. Now for weight loss, Wondr Health is what we were talking about just briefly earlier. This is the program that was formerly called Naturally Slim. This is a 10-week program. It starts with 10 weeks of classes, but it's actually almost a year-long program. So the initial 10 weeks are video sessions that you watch at your own pace. So each week there's another set of sessions. They come in video clips that you can watch individually, or you can watch them all at once if you choose. Some of them are as short as 2 minutes, some of them as long as 8 or 10. And they teach you skills each week that you then practice and then build each week into that. After the initial 10 weeks, then there's 24 weeks of follow-up. So it's a long program that's available to you. And we've had some tremendous results from the state health plan on this program. There is a program coming up. This is only offered 4 times a year. The next class starts November 8th. The application period opens 2 weeks from now. So the timing of this is perfect. You may actually, if you haven't participated in this class before, you may receive a postcard in the mail, or you may see some of these flyers that look just like this pink flyer out in your work or through your email. I think PEBA usually sends out an email just to let you know that the application windows are opening. But you can also see here that I've listed the website. If you want to go ahead, you can click on that website and apply now. What will happen if you want to go ahead and get your name on that list is you'll be put on the wait list, and then as soon as the application period opens on the 11th, you'll get an email that says your application has been submitted. By completing the application, you're committing to participate in the program if you're accepted, but there are some criteria, there's some clinical criteria that the Wondr folks will apply to your application to make sure that you fit the needs for the class. But again, this is an incredible program, and it's available at no cost to you. PEBA pays the full price of this program for you and your dependents. It's available age 16 and up. It is also available for people who have state health plan secondary, or for people who have Medicare primary with the state health plan as their secondary insurance. So this is an incredible benefit that's available to you. Now, PEBA Perks are benefits that PEBA has lined up for members at no cost to you. These are particularly done with the intent to keep members well. So these are things like screenings, immunizations, cancer screenings, those sorts of things. So one of the other pieces and parts of PEBA Perks is the Nopay Copay program. So members with chronic conditions, things like high blood pressure, high cholesterol, cardiovascular disease, congestive heart failure, diabetes. If you have a chronic condition and are on a maintenance medication, Nopay Copay could be a huge program for you. It's a program that's done in conjunction with Rally. So you would need to log into My Health Toolkit, create your Rally account, fill out your survey, and there's activities that you would complete each quarter. Each activity earns you points. So your goal each quarter is to earn 25 points. And once you hit the points for that quarter, you qualify for no-cost maintenance drugs for that next quarter. So if you're on a generic maintenance drug for high blood pressure or congestive heart failure, or your diabetic testing supplies, those things are available to you at no cost. At the end of the presentation, I'm going to show you on the website where you can find the details on this. But we actually have links on the website that show you which medications exactly are offered at no cost to you for this. So this is a huge program. There's several thousand people in the state health plan who are participating and getting the benefit for this each quarter. We've had a tremendous amount of success in this, and it's just a huge benefit for members who have these chronic conditions. Preventive screenings are also a benefit to you. These are available typically at your work site. You can attend one at your work site. You contact your benefit office to see if there's one available to you there. There's also regional screenings. The link for these are available on PEBA's website to show you where those regional screenings are, and you can sign up for one there. Or there are some screening providers that allow walk-in appointments. Again, that's all available on the PEBA website. If you participate in one of these screenings, there's a health risk appraisal, the blood pressure screening, height, weight measurements, blood work, and lipid panels that are available to you. The blood work that's available through this preventive screening is actually a really in-depth set of blood work. It's a lot of times more than what you would typically get in your well visit or your doctor's office visit. So what we encourage you to do in order to take the most advantage of your benefits and get the most out of it is to participate in one of these preventive screenings. Take the results from that screening and take them with you to your doctor for your appointment. That way the doctor has all of your lab work there, but again, it's a more comprehensive lab panel than what you would typically get in your doctor's visits. So it's just a huge benefit to you. Colorectal cancer screenings are another PEBA perk. These are available for anyone who meets the USPSTF standard for needing a colorectal cancer screening, which they just dropped the age for these. Historically, it has been 50 and older. Most recently, USPSTF, or the U.S. Preventive Services Task Force, I'm sorry, I get accustomed to using those initials, have recommended a reduction in that age. So from 55 down to 45, excuse me, from 50 down to 45. So this is one where colonoscopies are a huge piece of that, and they're really the gold standard in care. And colonoscopies are available to you at no cost. They also offer other colorectal cancer screening tests, but of course the colorectal cancer screening gold standard here is a colonoscopy. And mammography is also one of these benefits. So it's an important step for anyone. If you have a baseline typically around the age of 35 to 39 and then annual at 40 after that, mammograms are available to state health plan members annually at no cost. All key screenings for adult members to make sure that you're staying well and keeping yourself healthy. For these cancers, if you have a family history or not, we're finding more and more people are getting cancer at an early age. And so getting these screenings done and finding these things early have shown huge, huge impacts on treatment and survival rates. And so we really encourage you to participate and get those screenings done. You can visit and learn more. The website for that is www.PEBAPerks.com. And again, I'll show you some of this on our website here shortly. Adult vaccinations are also part of this. They are covered at 100%, and they cover, most recently, they added a Shingrix vaccine for shingles. There has been an older shingles vaccine, and I believe it was for age 55 and up, and now the new Shingrix vaccine is for a younger age, so that was added most recently, but all adult vaccines are covered there at 100%. Well-child benefits, of course, are also covered at 100%, so these are children 18 and under. They cover doctor's visits based on the recommendations for the American Academy of Pediatrics, and immunizations are based on the CDC recommendations. So all of those things that are recommended by those organizations are covered at no cost. Breast pumps are also huge benefit here. We all know the benefits of breastfeeding for newborns, for both mom and baby. And through the maternity program, breast pumps are available to members at no cost. You can enroll in the maternity program, and that health coach will help you, walk you through the process of choosing a pump, and then making your order, helping you place that order and get that delivered to you. So there's two ways to enroll in that program. Here's the website, which I'll show you here shortly. You can log into your My Health Toolkit account, select Wellness, and then go to Health Coaching, and it'll show you there. Or you can just call the Medi-Call number here and be connected with the health coach. Lactation consulting is also available at no cost through BlueCareOnDemand. The benefits are allowed at no cost to members through BlueCareOnDemand. So that's a great benefit to new moms. If you, and this is very near and dear to me because I have a 4-month-old at home, but if you've ever tried to manage a newborn and pack them up and take them to lactation consulting, it's a chore all in itself. So being able to have that benefit and those resources available while you're home and working through that process is tremendous. Cervical cancer screenings are also part of PEBA Perks. They're available to women age 18 to 65. You get a Pap test each year at no cost. And for women age 30 to 65, it also covers a HPV test in combination with the Pap every 5 years. Now, adult well visits are a new piece of the plan. and they are age-based. And so part of the adult well visit is you have that ability to use your adult well visit at your OBGYN or at your PCP. So if you so choose, you can have your adult well visit done at your OBGYN practice in conjunction with your cervical cancer screening. Diabetes education is also available to you at no cost. Oral health, I want to just take a few minutes and talk through this. We focus a lot on our physical health and our mental health, and we don't always link in how our oral health ties into those things. We know diabetes increases your risk for having gum disease and tooth loss. We also know taking regular care of your teeth and gums helps prevent heart attacks and strokes, and that there's a connection between heart disease and gum inflammation. We also know that having regular dental checkups and routine dental care can actually help you decrease the risk of passing along cavity-causing bacteria from mother to child. So it's important to keep those practices up during pregnancy. And then tips just for oral health in general: fluorinated water, of course, brush your teeth twice a day, floss every day. Store your toothbrush with the bristles up and let them air dry. A diet rich in vitamins and minerals, and then limit your alcohol intake. If you are a tobacco user, that has huge impacts on your oral health. So having connected with a Quit for Life coach to help you quit that tobacco product has a huge impact on your oral health. Now, member messaging is something that's also available to state health plan members. We have a roughly 90,000 state health plan members who are wired in to relay to receive these text messages. They're a great way to keep up with the benefits that are available to you. So you'll get benefits information. We don't send these out very often. You get a text roughly once a month to tell you about some services or benefits that are available to you. When Wondr Health applications open, you would get a text message there for things like that. So here's the phone number here. You call that from your mobile device, or you can text PERKS to 73529 and sign up, and you'll get, like I said, roughly about once a month, you'll get a text message with information on some benefits or some education pieces that are available to you. And if you sign up and you don't like the text message, you can always unsubscribe. My Health Toolkit is the app, and pretty much everything for the state health plan, all of your benefits, your explanation of benefits, so you can keep track of the claims that are filed to your account, how much your deductible, co-insurance, those things are, access to a digital ID card, access to your wellness programs, your Rally account, all of that's done through My Health Toolkit. So we really encourage people to sign up for our My Health Toolkit account. It really helps you take charge of your health and your insurance benefits. Your dental claims are there if you're through Dental Plus or Base Dental. You can manage your prescriptions. There's a link out to ESI through there for your Express Scripts for your pharmacy benefits. You can find providers. You can find both medical and dental providers in your area. You can search for the cost of services. So if you visit the state health plan website, you can create an account and get started there, and I'll show you in just a few minutes how to do that. Okay. I did see one or two questions pop up on chat, so I want to address those if I can, and then I'll show you the website. I know one came across that asked about COVID booster shots. Right now, state health plan does cover the cost of COVID vaccines, and it covers it at 100%. And if you are in a group that is approved for a COVID booster shot, the same benefit would apply. Okay, I'm gonna pull up the website now and show you that and where to find all these benefits. Okay. Once again, I just want to double check. Can you guys see my screen?
Yes.
Okay, thank you. This is the Blue Cross Blue Shield website that's dedicated to state health plan members. Here, the web link, which was in the presentation, is statesc.southcarolinablues.com. And you'll see here, this is dedicated to the state health plan. This box here, this member login, this is where you create your My Health Toolkit account, or if you already have one, you log in. Once you log in, the details that are present there are specific to you and your account. So that's where you would get your ID cards. You would see the difference or what's available left, or your copay, your deductible, out-of-pocket amounts, those sorts of things. You can look at your claims. You can access your wellness benefits. All of those are available there. But if you don't have an account, or if you're just looking for something, there's quick links here at the top for medical, dental, behavioral health, and then resources. So you can see here, you can find a doctor, your My Health Toolkit. You can check the status of your prior authorizations, your insurance benefit guide from PEBA. Here's your PEBA perks, your prescriptions, telehealth. All of these things are here available on the quick links. But if you scroll down, you'll see here they're laid out in a little more detail. So a couple of things we talked about. One was PEBA Perks. So all of the information on PEBA Perks is here, the Nopay Copay, the adult vaccinations, tobacco cessations, all those here. Details about your adult well visit, Rally account, telehealth is here. So this would tell you, here's your BlueCareOnDemand benefits. You also have some MUSC virtual care options that are listed here that I did not talk through earlier. So those are also available to you. I believe there's a fee for those, y'all, but that's not something that's managed by Blue Cross. So I don't know the details of that one as readily as I do the others. But again, here's health coaching. All of these things are available on this website. So if you ever have questions or need anything, this is a really great resource for you. Here's how you find a doctor. And I told the group on Monday when we talked through benefits, dental health being one of the big pieces that helps improve your heart health, your diabetes, all of those things. For Dental Plus members, and this is a Dental Plus enrollment year, if you have a dentist that is not in network and you're looking to get your dentist in network, the Find Dentist is here. So we can see, let's search by county. And I'm just going to put in a county. But if you don't find the doctor, the dentist that you're looking for here, there's a link here to nominate your provider. You can submit your dentist information to us, and we will go out and try to get your dentist in the network so that you won't have to pay the difference in the bill for your cleanings and services. So just know that that's also available to you. Okay. One of the other things I wanted to tell you a little bit about today through your behavioral health benefit is our opioid resource center. So opioid use and abuse has become another epidemic across our country, and it's impacted people of all ages, all races, all sexes. It doesn't necessarily matter. It's not discriminatory. What we've done is built an opioid resource center here. So if you or someone in your family needs help, this is here. It's available to you. Don't hesitate to reach out to our providers to help connect you with someone. There's a national hotline here that you can call, but you can also call the number listed on the back of your card, and we will absolutely help connect you with resources, find treatment centers. There's tons of things that we can do to help members along the way. So that is available here under the behavioral health tab. Just know that we have resources and things that we can help. That, along with the peer recovery support, would be huge impacts to people who are struggling with those things. And then there's always a resource tab here too, to find care. Here's where you sign up for text messages. But then in the spirit of being healthy, Live Healthy is a section here that also offers information on different health conditions. So if you're newly diagnosed with a health condition and you want to learn more about it, find out ways to manage it, you can click here. Or if you just are interested in some general health and staying healthy, there's a list of articles and things here that are always kept up to date. Okay. Does anyone have any questions? Helen, do you mind if we open up to questions at this point?
No, I don't mind. Go ahead.
It's a quiet group this morning. I threw a lot of information out to you in a very short period of time, and I believe these are recorded. Helen, correct me if I'm wrong. They'll be posted somewhere for them to refer back to later.
That's correct.
Question just came through. Are there any changes to the plans available this year? No, there are no major changes to the plan this year. There's some slight increases, I believe, in the premiums for Dental Plus and for Vision, but no benefit changes as of this year. Any other questions? We still have a few more minutes. Okay, well, I am happy to stay on chat if anyone has a question that they want to submit later. Helen, I don't know if you have anything else that you want to add, or if there's anything specific you want me to talk to, but that concludes my presentation for this morning.